Well, we are approaching 7 o'clock here on Hospital Radio Bedford and on HRB Breakfast, and of course on Soul Friday. And as you know, 7 o'clock, the session is all ready to bring us the COVID update. You don't get this anywhere but here on Hospital Radio Bedford. I promise you that. We've been doing this since the 2nd of February in the year 2020. And Dr. Session has been faithful. She's always been here to give us the COVID update. Right. Meanwhile, before I go on, I'd like to say once again, Chloe, that was your song, Waterfalls. Happy birthday, Chloe White, granddaughter of the godfather, Mr. Jeff White, or Dr. Jeff White, as the case is. Anyway, I'd like to say a huge good morning to you, Dr. Seshni. And even before Dr. Seshni joins us, I'd like to remind you that we are live on Facebook on Dr. Seshni's page, Seshni Mudlia, or on my page, Opoku Opare, or you can also go to the HRB Breakfast page and the Sunday Best Facebook page. We are live there. Good morning, Dr. Seshni. Welcome to the show.
Good morning, Opoku. Hope you are
well. You got to unmute yourself, Dr. Seshni.
Oh, good morning, good morning.
There you go.
Good morning.
How are you?
I'm great, thank you. How are you today?
I'm good. Yesterday the weather was way better than Wednesday, and today it looks as if it's going to be good as well. So yeah, we're looking forward to the bank holiday weekend.
Definitely. The weather was really warm yesterday. It was absolutely hot. It was really nice.
Yes.
Good to feel like some warm weather and to cheer everyone up, and also to get out a bit more. So I think anytime when the sun's out, people are a lot happier.
Absolutely. Dr. Seshni, this worrying thing I saw. I saw this thing on the news. I'm sure you've seen it because you're always preparing for this show.
Yeah.
And it's telling us about up to 75% of all new UK coronavirus cases could be the Indian variant.
Yeah.
That's scary.
Yes.
That's really scary.
So that is, I think it was gradually increasing. It was 25%, 50%, 60%, and now obviously it's gone to 75%. So the figures have increased. There is a huge concern about the Indian variant, as we've been talking about, and rightly so, because what they've identified is obviously there's different areas and regions in the UK where they have identified the Indian variant. And Bedford being one of the areas where
I know
there's a lot of restrictions. There's on the radio, on the news, on the television, there's warnings about people in these areas that they shouldn't travel outside these areas. So it is becoming a huge concern. It's still very much a concern in terms of the pandemic and in terms of the spread of the infection, because we are seeing that the numbers of people getting infected in the UK are increasing because of the Indian variant, and also because lockdown measures have been eased down, because a lot of people are going on holidays, they're going out to restaurants, they're traveling, they're visiting families and friends as well.
You know what bugs me really is when we are being told or advised not to travel out of the county or outside our community.
Yeah.
But we've got trains running constantly to London and Sheffield and different parts of. I mean, how does that work if you're telling us not to go, but you're providing for us to go? It doesn't really make sense, does it?
Yeah.
I don't know.
I mean, it's surprising, yes, exactly what you're saying. But the Indian variant, Opoku, is still a concern. I think that's the main message. And that's what.
How come this particular variant is spreading so quickly? Is there any scientific, explanation?
The way the Indian variant is, the way it's mutated, it's sort of triple mutated. So it's not one, it's not two, it's triple mutated.
Okay.
So because it's triple mutated, it's obviously then very, a virus is as strong as it can be. And when it's strong and when when it does the job that it's supposed to do, is it infects people and it makes them unwell with all the symptoms that we hear about. The runny nose, the coughing, the sneezing, the difficulty breathing, and some people end up quite seriously ill. So the symptoms can be mild, medium to severe, mild, moderate, or severe. So severe where people end up in ICU and end up dying. So, in the Indian variant, what we've seen in India is that it spread really fast. So, we've seen it in millions of people getting infected in India, and people dying. So, up to 4 to 5,000 or even more people dying per day. So, the reason why it's spreading so fast is because it's triple mutated. And so the virus has become more virulent, it's become very powerful, and it's in its ability to actually infect people and cause these infections. And also, it's more aggressive because it's spreading faster. The different variants we've been talking about, the South African, the Kent, the UK, the Bristol, the Brazilian, the Japanese, all these variants we've been talking about has been a concern because when the virus mutates, it's definitely changing its structure, meaning that whatever treatments we have, whatever knowledge we have about that virus, obviously it's becoming clever, and whatever we are using might not necessarily work. So with the Indian variant, it's done it triple times, so it's triple mutated. So there is a concern with this new variant. So according to Public Health England, they're saying and that's what I read yesterday as well. The figures have risen from 3,535 to 6,959. So that's quite a large number of people to, for the virus to sort of increase, isn't it? It seems like it's.
It is. The only thing I wanted to ask you concerning the numbers, especially in the UK, as compared to what's going on in India, and the way things are working, is that, or is it just me? But it seems as if, even though the numbers are rising in the UK, hospitalization is not as high, and the death rate is not as high as probably we're thinking it would be. For example, as you just read, Public Health England data shows that cases of the variant have risen by 3,535 to 6,959 since last week. But when you come down, on Thursday, for example, we a further 3,542 cases were recorded and 10 deaths. One would have expected, God forbid, but one would have expected that the death rate would be very high. And we are seeing hospitalization rates dropping rather than going high. What is the explanation, if you've got any at all?
Well, I think it's probably what they think is the vaccine rollout, that people that have been vaccinated, either one vaccine or the both doses of vaccines, that has helped with the reduction in the hospitalization. So it's possible what you're saying is true, that obviously people are getting infected. It is a concern, but actually the hospitalization figures are showing that it's much less. So it's good to take it in context. That's a really good observation, Opoku, that you've made. So yes, obviously this the Indian variant is still a concern, and as is the other variants, because we still have the other variants, as I mentioned. So it's still very much a concern. People are urged, obviously, to get tested. This variant is a B16172, and they said it is spreading faster. And there is now an increase in areas like Bolton, Blackburn, Bedford, Sefton.
Bedford,
So there's quite a lot of areas in the UK where it's a concern. And I think, I don't know if in Bedford, how you're feeling about it, because actually we spoke about the guidance, we at one end of it, Downing House 10 Downing Street, Boris Johnson and Matt Hancock, they're saying that you should not travel. So if you are in those 10 areas, you should not be traveling to any other areas, but they haven't actually imposed a local lockdown. So I'm not sure how you people are feeling in Bedford.
Well, I am self-isolating, so I'm at home anyway.
Yeah,
so for the next 7 or so days, I'm home. So I'm not going out anywhere, and so I don't really know too much. Usually or normally I would go out and look at things, and even if I don't go into offices or shops. I just go around, drive around, and see what the situation is like. I haven't been able to do that because I'm not allowed to. Generally speaking to my friends here in Bedford, people are a bit worried. They're thinking, "Oh God, what's going to happen?" And people are being careful.
Yeah.
I will add, my friends and people I've spoken to so far, they're being very careful. They're not going out as much as they should or as they would. And that even with a bank holiday weekend and all that, they're thinking about having barbecues at home, just them and the family, and all that. That's probably what I'll do as well. So even though it's becoming it's a concern in Bedford, I think that people are realizing that we should not do the things that we would be doing normally around this time, or just to prevent the spread of the Indian variant.
Yeah. So I mean that's good to hear. I wanted to just talk about travel. So the news says that that actually in 1.5 million people have flown in the UK.
I was about to ask you about travel, to be honest.
Yeah, first 4 months of 2021. So there's quite a lot of people that are traveling. You've recently traveled. And I think what caught my eye yesterday was France and few of the European countries are actually imposing because of the new Indian variant. So the Indian variant is definitely a huge concern because it's going to impact on a lot of things. At the moment, France and other countries are requesting that people that come from England will self-isolate and be in quarantine for a week.
For 7 days, yeah. Yeah.
So what are your thoughts? And I know you wanted to travel to France. We wanted to travel to France as well, but there's just absolutely no chance.
I don't want to go. I don't want to go to France and self-isolate for 7 days. No way.
Well,
so
that's it.
No, because usually you go to France, you go in and you come out the next day or so and do what you have to do and just get back. Now you're gonna have to quarantine for 7 days, and then what? So I won't go. If I have it, I won't go to France anytime soon, unless this restriction is lifted. But then again, I do understand the French government because we all know where they are on the list. And it's not cool in France when it comes to infection. So the government they're doing their best to save their people and to save lives. And so I do understand them putting restrictions on UK travelers into France because of the Indian variant that is spreading really quick and fast here in the country. But I pray and hope that things will change since the vaccination rollout is going on seriously, and now 31 it's their turn to get the vaccine and all that. So hopefully things will get better.
Yeah, exactly. The other thing that I just wanted to highlight was, well, obviously there's been lots of talk, keeping politics aside, but there has been talk about Matt Hancock has been criticized about his management of the pandemic. So that has actually come through yesterday. There was a lot of talk about it. So I think people are urging that there is an inquiry into what happened in the early days of the pandemic when thousands of people lost their lives. So there's a lot of criticism at the moment. In his defense, he's saying that obviously he did his best. So we'll see what happens.
I personally think that mistakes were made, and mistakes will always be made. And so we rather than dwelling on the past and staying there and talking about what mistakes were done, we should just forge ahead. Of course, we should recognize the mistakes that were made, but at the same time use it to use it as a learning curve, and move on and crack on with the job. I think there's a lot of pressure on that man, and because he's the health secretary, there's a huge pressure. I couldn't do his job for one day. So yeah, I mean, if he's made mistakes, yes, fine, and he needs to correct them, but um, let's just move on and make sure that we learn from our experiences and from our mistakes. Right. Now, the other thing I wanted to talk about is obviously, with all due respect to Lisa Shaw's memory.
I've actually just got that in front of me.
Family as well. We want to apologize if there's anything that's not said right here, even before I start. But I like to respect her memory, and also to respect her family. But let's talk about the fact that the family are saying that she was treated for blood clots days after her first jab. She did that on Friday. May her soul rest in perfect peace. And an interim fact of death certificate actually lists the vaccine, the AstraZeneca vaccine, as one of the possible factors being considered. And it takes us back to those days when we were talking about side effects of the AstraZeneca and blood clots and possible cause of death and all that. Of course, they are saying that the Medicines and Healthcare Products Regulatory Agency are saying that the vaccine benefits exceed the risks for most people, which we understand and we know is true. But this particular story brings this I don't know how to put it, but people are starting to think, should I not?
Yeah, this is a huge concern. I was actually looking at the same news this just now, and heard about it. It's been going on for a few days. It's sad to hear about Lisa Shaw, and our condolences to her family. And obviously, it's tragic. I mean, they are saying that vaccine role in the BBC presenter's death to be probed. So, as you've just rightly said, she had the AstraZeneca vaccine. She had within a week she started having headaches, and then was treated for blood clots at the hospital in Newcastle, the Royal Victoria Infirmary. And yes, tragically she died on Friday. So people are obviously asking a lot of questions, and especially because Lisa Shaw was in the media. She's a really well-liked presenter. And it's quite sad, actually. I know there were tributes from a lot of the media people from Friday onwards. So it is quite sad. But yes, there is going to be a lot of people wondering, definitely did the AstraZeneca play a role? And it seems quite possible from the information that we've had, and we've spoken about blood clots as a side effect of the AstraZeneca. And obviously, few countries had banned the AstraZeneca vaccine because of that. So it is obviously a concern. And again, as you said, people are going to wonder, should I take the vaccine or shouldn't I take it because of this? And especially people have underlying hematological or immune problems, or immunocompromised, people with cancer, so people with other clotting disorders. All these people will obviously, and blood disorders, thalassemia and all of that, leukemias, all these different disorders to do with blood and blood cells. And also the lungs as well, because when you get blood clots, it affects you, end up getting a pulmonary embolus and then dying, or you can get a stroke and die. So that's how we spoke about it the last time. So that's if already, as I've just said, there's just so many people that fall in that category in terms of high risk groups. So And
mm,
that's not even, I haven't even mentioned people with high blood pressure, people with
mm,
diabetes. So there's obviously going to be a concern amongst a large group of people with
mm.
underlying physical health conditions. I think that's what I'm
Okay.
trying to say.
All right.
And then,
Okay.
but if people are concerned, they need to contact their GPs, contact their health professionals, and get some further advice about it.
Okay. Thanks for the advice. So if you're concerned, especially if it's based on some of the stories you're hearing, um,
Yeah.
just contact your GP as Dr. Session will is advising. Now, Dr. Session, before we go to the numbers quickly, let me ask you. I saw this article as well about, all these waiting times, surgery waiting times. Um, you know, and they're saying that it could be cut with specialist hubs. Surgeons are advising it, and obviously it's because of the COVID situation. So, so many, more than 436,000 were waiting more than a year. Um, for surgeries, very important surgeries like hip replacement and things like that. You, as a consultant psychiatrist and as a doctor, how has that affected your work? I mean,
Yeah.
how has this whole COVID situation affected your work
Well,
and probably that of your colleagues?
yeah. So it's affected. So, the Royal College of Psychiatrists issued a statement very early on in the
Mm,
pandemic saying they're seeing a tsunami of cases. So,
yeah.
in addition to people with underlying mental health conditions, we've seen an increase, double or triple the amount of people in terms of people presenting with newly diagnosed
Mm,
mental health conditions. And you must understand there's a lot of mental health consequences as a result of COVID. So
yeah.
people having the infection themselves and then suffering with PTSD or long COVID symptoms, depression, fatigue, and all of that contributing to other mental health disorders if they've got underlying conditions like
Mm,
schizophrenia, bipolar, anxiety, OCD. We've seen coronaphobia, chronophobia. We've seen depression, people being suicidal, people taking overdoses, self harming, and then also people, um, sort of becoming more addicted to substances like alcohol and drugs.
mm,
So, all of these conditions, in addition to obviously grief, because a lot of people have
yeah.
lost, millions have lost loved ones either due to COVID or not to COVID. So, we've all
Mm,
had to deal with some sort of psychological manifestation of COVID. It definitely has affected our workload, as you can imagine. So, we
mm,
are seeing, so as much as there's a lot of physical health concerns, there's a lot of mental health concerns, and people are raising more and more awareness about mental health conditions.
mm,
I just wanted to say that yes, I listened to the GP, the head of the GP of the Royal College of GPs in London, and they were saying that, as you've just pointed out, there's a long waiting list of people. Their workload has sort of tripled as well, because they have seen so many cases of people because of COVID. And then because of other underlying conditions. And what has also happened with physical health conditions, I'm talking about mental and physical health because our mind and body is linked. So
really?
if people are going to have physical health conditions, it's going to affect their mental health and vice versa. So the physical health, what the Royal College of GPs is saying is that there's been a waiting list because obviously some people have not gone to GPs because they did not want to get infected or because of safety. And they've obviously developed some conditions during this time. So they are having to see, as much as the backlog of surgeries, they're also having a backlog of other people with underlying physical health conditions that obviously need diagnosis and need attention. So they are seeing not only COVID patients, not only people with the known physical health conditions, but also there's a backlog and there's a huge waiting list of people that need diagnoses. And this is something we've heard about. I mean, I've spoken to a lot of people and my own clients and patients themselves. So our workload has definitely increased across the board. I would say not just in mental health, across the whole of NHS in terms of
NHS. Mm,
all the the different specialities in terms of operations, in terms of, cardiac, diabetes, rheumatology, orthopedics, and all the specialist infectious diseases, pediatrics, obs and gynae. So all the disciplines, all the doctors, all the nurses, all the teams, community teams, everyone is under a lot of pressure,
Okay.
and they are seeing a lot of cases.
All right. Okay. Thanks for the information. Let's get the numbers before we run out of time. It's just 6 minutes
Yeah.
to go. The time runs fast when you're not.
Yes, I know. And there's just so much to talk about. We haven't even spoken about half the things that I wanted to say. I was listening to something interesting about there's a lot of drivers that are waiting for their tests, and there's a long waiting list there as well. So there's like lists for so many different things. So in terms of the figures, the Waldometer as of today, is it today?
The 28th of May.
28th of May. It's 169,648,062 cases. Yeah. So that's quite a lot. Total number of deaths is 3,525,426 deaths. Total recovered 151,381,102 deaths. So that's quite a lot as well. Recovered. Yeah. In terms of the top 5, USA number 1 with 33,999,680 positive cases. Total number of deaths in the USA is 607,726, and USA remains number 1. India's number 2 with 27,555,457 positive cases. So India is really increasing.
It is,
with 318.
It's catching up quickly with the US, isn't it?
Yeah, 318,895 deaths. Brazil number 3 with 16,342,162 positive cases with 456,753 deaths. France is 635,629 positive cases with 109,165 deaths. Turkey is number 5 with 5,220,549 cases with 46,970 deaths. UK number 7 with 4,473,677 positive cases with 27,758 deaths. So obviously still increasing. South Africa number 20 with 1,649,977 positive cases with 56,170 deaths. And Ghana quite low down with number 96 with 93,723 positive cases and 783 deaths. And UK in the last 24 hours, obviously the Indian variant is still a concern. And people need to stay safe this weekend. So 10 new deaths with 3,542 new cases. So have a fantastic weekend, Opoku. Long bank holiday weekend. I don't know if you're traveling or you're obviously in quarantine. You have to stay in isolation.
Yeah. It doesn't stop me from having a little barbecue around my back.
Well, enjoy your barbecue. Enjoy it. I think we're going to probably be doing the same. And stay safe, everyone. Let's spread the love and not the virus. Love to your family and everyone at home.
Love to yours as well. Thank you very much, Dr. Seshnik Mudia.
Thank you
for joining
so much
us this morning. I know you're a very busy woman today. And,
no, I've just got an online conference, so it's online, but it's still, it's like sometimes a lot of things are online, but you're still having to do preparations. But
exactly.
I'm looking forward to the weekend.
I had to pull you out of that to come in. And thank you very much for joining us, and have a fantastic weekend, and hopefully I'll see you Monday.
Yeah, enjoy your barbecues. See you on Monday.
Thank you. And you enjoy your braai.
Enjoy your braai. Thank you.
All right,
Bye.